In the weeks before birth, your body slows down production of the hormone progesterone while increasing production of other hormones, including prostaglandins, which soften the cervix, and oxytocin, which triggers the uterine muscles to contract. True labor contractions are rhythmic and painful and grow consistently stronger. As the long vertical muscle bands of the uterus tighten, they pull the cervix open. The strong muscles at the top of the uterus push down and release, guiding your baby toward the cervix. The mucus plug, a collection of thickened cervical mucus that sealed your cervix shut for 9 months, may be expelled days before or in the midst of labor. When the amniotic sac ruptures, your water has broken. It can feel like a trickle or a gush of fluid. Your cervix will begin opening and thinning, known as dilation and effacement. Once you reach about 4 centimeters, your body will move into active labor. In active labor, contractions become stronger and closer together. At 8 centimeters, you enter what many consider the most painful part of labor, transition. By 10 centimeters, you're fully dilated and may feel the urge to push. This is your signal that the second stage of labor has begun. Your baby will move down with each contraction. The 3 separate soft bones of his head will temporarily overlap so he can pass through the snug birth canal. Your baby's scalp will come into view. When the widest part of his head is visible, your baby is crowning. With several more pushes, your baby's face, shoulders, and body will emerge. In the third and final stage of labor, your placenta detaches and is expelled. With your baby's first breath, the incredible journey of birth is complete.
Clomiphene is a fertility medication sold under the brands Clomid and Seraphine. This drug is usually prescribed for women who ovulate irregularly or not at all. Here's how clomiphene works for women. Several days into the menstrual cycle, you will take a pill every day for 5 days. The medication encourages your brain's hypothalamus to produce luteinizing hormone, or LH, which tells your ovaries to release eggs into your fallopian tubes. You'll generally ovulate between 5 and 12 days after you finish the last pill. Between the time when you take clomiphene and when you ovulate, your doctor will monitor you carefully to see whether your ovaries are preparing to release an egg. Clomiphene is quite effective at stimulating ovulation. In fact, 80% of women who take it will ovulate within several cycles. But ovulation does not guarantee conception, and only about 40% of women taking clomiphene actually get pregnant. Clomiphene can also help men who have a low sperm count or who have poor sperm quality. When a man takes Clomid, it encourages his pituitary gland to make LH, which tells the testicles to produce more testosterone and possibly more sperm. Men take clomiphene in cycles that last from 3 to 6 months. Clomiphene is less expensive and less invasive than other fertility treatments and can be a good first line of attack against infertility.